Hello, my friends. Dr. Rick. How you doing? I had a patient this morning, and she was complaining that she was getting a little bit of a shoulder pain that was running down her arm, and it was a condition that she had in the past, and she hadn't had it for a while. And so one of the first questions I asked is, how was she sleeping, and what sleeping posture was she sleeping in? And she mentioned that she slept on her back last night. And this morning she came up with pain. I said, well, how was your pillow? What kind of position was your pillow in? And she said, well, I was kind of stuffy and I put a lot of pillows behind my head. So what happened was she had a clogged nose, wanted to prevent her nose from getting clogged more, propped her head forward and slept in that position. So when you sleep with your head propped forward, you're taking your normal, natural cervical curve and bending it in the opposite direction. So if you're sleeping like this, the curve is bending like that. That is causing more pressure on the nerves. It allows the disc to bulge out more towards the back and hit the nerves. So ideally, when you sleep, as well as any other posture, you want to try to maintain the three primary curves as much as possible. The neck curve should have a curve going this way, mid back this way, and lower back this way. So if you hold these curves, or you keep these curves, your spine is in a stronger and healthier position, and it prevents the irritation or pressure on your nervous system. The curves are there for a reason. They serve as a shock absorber, like a spring, or they will divert forces in different directions or different vectors. So if you notice in architecture, we use an arc to hold up a lot of weight, because that arc is very useful to hold the weight and disperse the force in different evenly patterns. Mother Nature, God if you will, is much more intelligent and knows to design the spine with that same architectural support, having those curves. So sleeping posture is important. When you sleep on your back, maintain the curve. One of the things you can use is a cervical pillow to do so. Cervical pillow has a cutout here with a big part here to go behind your neck and allow the maintenance of that cervical curve. If you have too many pillows, or the pillow's too thick, it's going to push that cervical curve forward. Sleep is important. So make sure your neck is in proper position when you're on your back, and when you're on your side, make sure the pillow is thick enough to make up the width of your shoulder, so that your head is not being propped up or being drooping down or compressing towards the mattress. When you lay on your side, the spine should be straight. So looking at the spine from straight on should be straight in this direction, and three primary curves in this direction. Sleep is something we sometimes take for granted. If you think about it, sleep is a third of every 24-hour period of time. And if you think about 1/3 of the day, or 1/3 of the week, or 1/3 of the month, or 1/3 of the year, or 1/3 of your life, you're spending in that sleeping posture, if you're sleeping approximately 8 hours a day. So it's a lot of time that you're spending with your spine and your nervous system in a certain configuration. Why not make it in the most healthiest, the most restful position as possible? So for 1/3 of your life, pay attention to your position, to your posture, so that your nervous system can work optimally. Thanks. I'll talk to you later.